Hi everyone, today our video is about the important questions which are repeated in a final examinations for a psychiatric nursing. So here the long essay questions which are repeated in exams are general principles and standards of mental health nursing in India, discuss process recording and its use, explain the nurse role in a community mental health nursing, discuss in brief detoxification and abuse, narcotic antagonist therapy, and harm reduction of patient with substance use disorder. Describe etiology and psychopathology of patient with personality disorder. Historical development of community mental health service in India. Discuss the nature, settings, and functions of contemporary psychiatric nursing practice. Mention types of substance abuse. Explain nursing care of patient with alcohol abuse. What is bipolar disorder? Explain care of patient with acute depression. Discuss the admission and discharge procedures according to the Mental Health Act. Explain the different types of crisis and discuss in detail the steps of crisis interventions. What are the clinical features of delirium and explain the nursing management in acute delirium. Define crisis and discuss nurses' role in crisis intervention. Describe nurses' role in psychiatric rehabilitation. Explain the admission and discharge procedures according to Indian Mental Health Act. Define mental health and mental health illness. Explain in detail the principles of mental health nursing. Define BPAD and classify the various mood disorders. Discuss management of depressed patient. Next question, define ECT. Describe care of a patient before, during and after ECT. Define therapeutic communication. Explain the phases of therapeutic communication techniques. What is electroconvulsive therapy? Explain the role of nurse in ECT. What are the clinical features of catatonic schizophrenia? Explain the nursing management of a patient with catatonic schizophrenia. Define community mental health nursing. Discuss the role of nurse in preventive psychiatry. Define bipolar disorder. Explain the role of nurse in the care of a manic patient. Define substance abuse and explain the treatment and nursing management of patient with alcohol dependence syndrome. Explain the etiology of psychophysiological disorders. Describe the management of patient with Crohn's disease. Describe the clinical features in mania. Prepare a nursing care plan, mania, for a patient with manic episode. Define mental retardation. Discuss the nursing management of a child with profound mental retardation. National Mental Health Program, therapeutic nurse patient relationship, depressive disorder. So these are the long essay questions. Okay, and short essays are classification of mental disorders, interpersonal environment, communication model, toxins and poisons, psychophysiological disorder. List the functions of mental health team, psychodrama, discharge procedure, tics disorder, theory of grief, theories of grieving process, obsessive compulsive disorder, forensic psychiatry, behavioral problems of adolescents, crisis intervention, neurological assessment, mental retardation, mental health team, national mental health program, purpose of nursing process in the psychiatric nursing, childhood schizophrenia, neuroleptic malignant syndrome, scope of psychiatric mental health nurse, describe the major concepts of community mental health, discuss the stages of family therapy, legal aspects of psychiatric nursing, anxiety, crisis intervention, play therapy, sociopathic reaction, benzodiazepines, narcissistic personality disorder, clinical picture in generalized anxiety state, management in phobia, suicide prevention, antidepressants, criminal responsibility, levels of prevention, sexual disorders, characteristics of mentally healthy individuals, classify personality disorder, neuroleptic malignant syndrome, conduct disorder, alcoholic anonymous, care of patient with suspicious behavior, lithium carbonate, milieu therapy, daycare centers, any 5 general principles of psychiatric nursing, alcohol dependence syndrome, explain signs and symptoms of post-traumatic stress disorder, and briefly explain the nursing management for a patient with PTSD. Describe etiological factors and signs and symptoms of attention deficit hyperactivity disorder, occupational therapy, mental health issues among elderly, explain therapeutic impasses and interventions for overcoming them, explain the current trends in mental health nursing, differentiate institutionalization and deinstitutionalization, types of admission and discharge for mentally ill, Johari window, existential model, difference between normal and abnormal behavior, explain the role of nurse in occupational therapy, antipsychotics, obsessive compulsive disorder, therapeutic community, discharge procedure, group therapy, techniques of therapeutic communication, concept of normal and abnormal behavior, antidepressants, civil right of mentally ill, alternative system of medicine, somatoform disorders, management of patient with aggressive behavior, phobias, nursing management of patient with narcotic withdrawals, enuresis, extrapyramidal reactions, halfway homes, history collection in psychiatry, concepts of normalcy and abnormalcy, psychosomatic disorder, antipsychotic drugs, substance abuse, conduct disorder, obsessive compulsive disorder, epilepsy, rehabilitation. These are the short essays, okay, which are 5 marks questions. And next, very short answers. Free associations, halfway homes, delusion, neologism, word salad, auditory hallucination, thought broadcasting, rapport, fetish, atypical antipsychotic, token economy, intelligent quotient, delusion, auditory hallucination, sheltered workshop, lithium, projection, echolalia, aversion therapy, cognitive development, detoxification, genuineness, integration, magical thinking, mental imagery, phobias, reaction formation, selective abstraction, abreaction, delusion of reference, alcohol withdrawal symptoms, contraindications for electroconvulsive therapy, voyeurism, transference, reception order, defined dementia, childhood autism, echolalia, agoraphobia, mood and affect, hypochondriasis, reaction formation, biofeedback, neurosis and psychosis, narcoanalysis, oncologic crisis, guided imagery, REM fits, advantages of token economy, indications of light therapy, types of crisis, meaning of enuresis, lists the sexual disorders, anti-abuse drugs, meaning of obsession, lists the types of phobias, leave of absence, dementia, grief, forensic psychiatry, fague, cataplexy, phasia, neologism, perseveration, labile effect, cyclothymia, ambivalence, delusion, flight of ideas, confabulation, transvestism, attention deficit hyperactive disorder, process recording, token economy, akathisia. Differentiate between the psychosis and neurosis, purposes of ego defense mechanisms, enumerate stages of grieving, testamentary capacity, cognitive behavior therapy, objective of National Mental Health Program, purpose of classification of mental disorders, disorders of perception, psychosexual disorders, patient rights, disulfiram drug, amnesia, insight, grandiose delusion, play therapy, hypnosis, definition of mental health nursing. So these all the important questions of mental health nursing. Thank you.